right, guys, welcome to week 9. This week we're going to be looking at the upper limb. Specifically, we're going to be looking at the forearm and the hand. So to get it started, I want to look at the bones, but of course, before I say that, I want to preface that this resource is a supplement and not a replacement for your time spent in lecture, lab, and office hours. This is meant to help your learning in those times and not replace it. In saying that, let's get started with this week's material. So we're gonna start at the bones. So the first bone that we're gonna be looking at is the distal humerus. So last week we were looking at the proximal humerus. Remember, we were looking at the head of the humerus. We're looking at the greater or lesser tuberosity, the neck, the shaft, right? All of that has to do with the mostly proximal humerus, right? Now we're going to be looking at the distal humerus, right? So our distal humerus has two structures that we want to highlight, right? The first of which being the trochlea and the capitulum, right? So the trochlea and the capitulum. So if I inspect that, right? This rounded circular projection right here, this is our trochlea. And then kind of this cap-like rounded structure, right? This is our capitulum. So trochlea, capitulum. Right, so now let's go back to the radius and the ulna. Right, trochlea and capitulum are these are the parts of the distal humerus. Now we're going to go to the radius. This is our radius, right? Radial side. Right, our radial side is going to be on the side of where our thumb is, right? So our thumb is on our radial side. Um, so here we have the radius, right? We have the head of the radius, right? The head is going to articulate with the capitulum, the cap. You can kind of see how that rounded projection is going to sit, right? With the head of the radius, right? We also have the radial tuberosity, right? Or yeah, radial tuberosity, right here, radial tuberosity. Right? You can see kind of this bulge here, the radial tuberosity. And then we also have the styloid process of the radius, right? Here, styloid process of the radius. Right? All right, so the radius is going to have a head, right, that's more flat and indented, right? So whereas the ulna, it's going to differ because it has a couple of other um, structures that we need to know. It has one other structure that we need to know that's not similar to the radius. So this is our ulna. If I inspect it, we have the trochlear notch, right? So you see how you see this C shape here, right? This is the trochlear notch. So our trochlea of the humerus is going to articulate with the trochlear notch of the ulna, right? So you kind of see how it's like a lock and key type of thing, where you have this little swivel projection, whereas this is holding, right? This is where the trochlea is resting in the trochlear notch. And then we have another structure, the olecranon process, right? So this looking superior, looking at the most superior point of the ulna, we have the olecranon process. Right? So we have that, and then we have our ulnar tuberosity. So right here, if I inspect again, This is our ulnar tuberosity. And then we have our styloid process of the ulna. Now let's get into our wrist bones. Right, so it gets a little bit complicated, right? These are called the carpals, right? So um, it's very imperative that you guys try to find some way to memorize these because they can get confusing. So remember, we have tarsals in the foot and we have carpals in the hand, right? So remember, it goes from tarsals and the foot, right? All the tarsals to the metatarsals, and then you have the phalanxes, or you have the phalanx, or you have the phalanges, right? Which is multiple, right? So in the hand, we go from tarsals to metacarpals to phalanx, plural, phalanges, right? So very similar, very similar. So the way I remember it, the way I remember these is a mnemonic that I use: so long to pinky, here comes the thumb. All right, so long to pinky, here comes the thumb. But when you're starting with this mnemonic, you start on the radial side, but not the bone that's connected to the thumb, but the one that's higher, right? So a little bit more superior, right? So the first bone that we're starting with is the bone that's directly anterior to the styloid process of the radius, right? So styloid process of the radius, we're looking for the bone that's anterior, scaphoid, right? So scaphoid is our first bone. So long to pinky, here comes the thumb. So scaphoid for S, long for lunate, right? So long, right? And then we have the two, which is triquetrum, right? Triquetrum is the bone under, right? Triquetrum. And then we have P for pisiform. So long to pinky, P for pisiform. Here comes, right? So here is hamate, right? You can see it kind of has a little bit of a projection on it that looks like the handle of a hammer, right? So long to pinky here, and then we have C, which is capitate, comes capitate the thumb, right? So we have trapezoid and then trapezium. So trapezoid and then trapezium, right? So I always remember trapezium is thumb. Trapezium, right, is near the thumb. Trapezium is near the thumb. So again, scaphoid so, lunate for long, 2 for triquetrum, P for pisiform for pinky, and then we have hamate for here, and then we have capitulum for comes, and then we have capitate for comes, and then we have trapezoid for the, and then we have trapezium for thumb. So long to pinky, here comes the thumb, right? And then we have, similarly with the foot, we have our metacarpals instead of metatarsals. So metatarsal 1, metacarpal 1, metacarpal 2, metacarpal 3, metacarpal 4, metacarpal 5. So these are metacarpals, right? Not metatarsals, right? The metatarsals are in the foot, the metacarpals are in the hands, right? And then we go back to our phalanxes, right? Our phalanx and our phalanges. So we have phalanx is singular, phalanges is plural. So do not write phalanxes, right? Phalanges for plural if you have to do that, right? So we only have phalanx singular and phalanges plural. So if we're looking at our phalanges, our proximal phalanges, we have one, two, three, four, five, right? So there's proximal phalanges in digits 1 through 5, right? And there's only intermediate phalanges in digits 2 through 5, right? So digits 2, 3, 4, 5 only have an intermediate phalange, right? Only have intermediate phalanges, whereas all of the digits have distal phalanges, right? So distal phalanges of digit 5, 4, 3, 2, and 1, right? So this is 1, this is 2, this is 3, this is 4, this is 5. These are all digits. So when you're writing the name of the structure, make sure you're saying proximal phalanx of digit 3, or well, this would be the proximal phalanx, but this is proximal phalanx of digit 3. Distal or sorry, proximal phalanx of digit 1, but I'm looking at the content sheet. This would be proximal phalanx of digit 3. But make sure when you're saying something, make sure you're denoting that it's proximal distal, right? If it's there's multiple phalanges, if it's singular phalanx, what digit is it, right? So make sure you're writing that down. So I was using it as an example. I wasn't trying to highlight which structure it was. So if I'm going to give a prime example, right? So this would be the proximal phalanx of digit 3. This would be the distal phalanx of digit 3. This would be the intermediate phalanx of digit 5, right? This would be the proximal phalanx of digit 1, right? Digit 1 doesn't have an intermediate phalanx, right? So make sure that we're denoting the singular, the plural, the digit, whether it's proximal, distal, right? Make sure you're, or intermediate, make sure that you're denoting that. Okay, so now we're going to move on to the wet lab structures, right? So we just went over the bones. Now we're going to go over the muscles of the forearm, hand, blood vessels, and nerves. So we're going to start off with the anterior compartment, right? Forearm gets very complicated and challenging for people because they don't really understand where the distinctions with the compartments lie. And it kind of confuses your positioning with where you are, anterior or posterior, and what muscle you're looking at and what its name is, right? So I'm going to start off giving our bearings, right? So the anterior compartment, right? All right, so the anterior compartment goes from pronator teres, right? This muscle here, right? So this is medial, right? So your pinky side is medial, your thumb, this side is lateral, right? So the radial side is lateral, the ulnar side is medial. Right, so remember your hand is going to be pronated, sorry, supinated in anatomical positioning. So your hand, your palm is going to be upwards or right away from you, right, going out in anatomical positioning. So it's going to be in the supinated position, right? So make sure that you understand that your arm is going to be in the supinated position in anatomical positioning. So our anterior is going to be from pronator teres all the way to flexor carpi ulnaris, right? So this is flexor carpi ulnaris, right? So between these two regions here lie your complete anterior forearm compartment. Whereas your posterior forearm compartment is going to be from brachioradialis, which is this muscle here, all the way to extensor carpi ulnaris. So we said this is flexor carpi ulnaris. This is going to be extensor carpi ulnaris, right? So flexor, extensor, flexor, extensor, right? They're both on the ulnar side. They're going to be flexing the carpals, right? Flexing or extending the carpals, right? So they're both on the ulnar side. They just have different functions, right? And are different sides of the carpals. So now that we know that, so we have our bearings. So we said that our posterior compartment is from brachioradialis to extensor carpi ulnaris, right? So make sure this is our posterior compartment. So now that we have that, I'm going to start off with the anterior compartment, and we're going to look at the muscles of the anterior compartment, and I'm going to highlight the bones so we can see. So radius ulna. I can't really highlight all the be able to go sit and see. So, but okay, we're gonna start off with pronator teres, right? So, like I said, this structure here is pronator teres. Right, pronator teres goes from humor and ulna to radius, right? If I examine, it goes from the humerus and the ulna to the radius. So you can see it going from the humerus to the ulna and then to the radius, right? Pronator teres is responsible for pronation, right? The name is pronator teres, so it's going to be responsible for pronation, right? So if I look at, if I go, so I can see, right? It's going from all those three locations, like I said, humerus, ulna to radius, and you can see it going to the ulnar tuberosity, right? And then to the radius. Right, this muscle is going to be responsible for pronation, as I said. Right, remember all the muscles of the anterior compartment of the forearm are going to be innervated by the median nerve for the most part, most of the muscles, right? And then you have a few that are going to be innervated by the ulnar nerve. So most are going to be innervated by the median nerve. Remind yourself that the median nerve is going to be innervating most of the muscles of the anterior forearm and some of the muscles of the hand. Right, so we have that. Now we're going to move on to another muscle. We're going to be moving on to palmaris longus. So we have pronator teres. Right, this is the next muscle to start off with. That's very evident that you can see it when you're looking at the anterior compartment. Right, palmaris longus. Right, you can see it here. Going all the way from right the medial humerus to the carpals. Right, and this muscle is responsible for wrist flexion. Right, we can see it, palmaris longus. Right, so our next muscle that we're going to look at is flexor carpi radialis, right? So it's actually in between the two muscles that I just mentioned. So pronator teres and then palmaris longus. Flexor carpi radialis is in between those two muscles. So flexor carpi radialis is going from medial forearm to the metacarpals. Right, and this muscle is flexing and abducting, right, abducting the wrist. So flexing and abducting the wrist. Right, and it's innervated by the median nerve. Palmaris longus, median nerve. Pronator teres, median nerve. And the next muscle we're going to look at is flexor digitorum superficialis, right? So this would be flexor digitorum superficialis. If I examine it, it's going from generally the forearm to digits 2, 3, 5. 2 through 5. So flexor digitorum, right? Digitorum, digits. It's going to be flexing the digits, and it's a superficial muscle. So flexor digitorum superficialis, right? And it's going to attach to the intermediate phalanges of digits 2 through 5, right? Otherwise known as the proximal interphalangeal joint, the PIP joint, right? So it's going to be attaching to those joints. And then we have the flexor digitorum profundus, and remind yourself that The flexor digitorum superficialis is being innervated by the median nerve, right? So this is superficial, and then we have flexor digitorum profundus, which is directly under superficialis. Right, and if we look here, this is going to the digits 2 through 5 as well. And it's going to the distal interphalangeal joint, right? So we can see it going all the way there. So it's going all the way from the forearm to digits 2 through 5, and it's going to be flexing the wrist in digits 2 through 5. Similarly with superficialis, but they're going to be flexing at different points. So superficialis is going to be flexing the PIP joints, whereas profundus is going to be flexing the DIP joints, the distal interphalangeal joints. Right. So, and with this muscle, the ulnar half is going to be um, innervated by the ulnar nerve, and the rest is the median nerve. So, like that half of this muscle that's on the ulnar side is going to be innervated by the ulnar nerve. Right. The ulnar is the medial side, and then the rest is the median nerve. So the other half is on the this side is going to be innervated by the median nerve. So, in saying that, we have one more muscle in the anterior compartment that we need to know, and it is flexor pollicis longus. Pollicis means thumb. Of course, you know what flexor is, right? So that's flexor pollicis longus. And I'm going to still click it in selection so we can see it next to profundus, flexor digitorum profundus. So flexor pollicis longus, you can see it right next to flexor digitorum profundus. You can see it there. So I want to deselect digitorum profundus so we can only see. Oop, I think I just canceled everything out. Let me get that back. Okay, so I'm going to remove superficialis and only select flexor pollicis longus. Then I'm going to select the radius and the ulna. There we go. Okay, there we go. So we can see it always going. We can see the tendon going all the way to the thumb. So flexor pollicis longus is going to be responsible for flexing the wrist and the thumb, innervated by the median nerve. All right, so we got that. Now we're going to move on to the last muscle of the anterior compartment, which is flexor carpi ulnaris. Remember, I said this is where this is where the anterior compartment is going to end, right? So I said the anterior compartment goes from pronator teres all the way to flexor carpi ulnaris, right? So this is the last muscle of the anterior compartment. So if we look at flexor carpi ulnaris, it goes all the way from the medial forearm to the metacarpals, and it's going to be responsible for flexing and adducting the wrist. So flexing and adducting the wrist. And this is going to be innervated by the ulnar nerve. So now that we have that down, we're going to look at the posterior compartment. So we're going to start looking at the posterior compartment. So the posterior compartment, like I said, starts at brachioradialis, and it goes all the way to extensor carpi ulnaris. So we have brachioradialis here. Let's start that being the first muscle, right? So if I examine that, let me select the radius and the ulna. Okay. So we have brachioradialis, Brachioradialis is going all the way from the humerus to the radius. Makes sense. Brachioradialis, arm, right? So brachial is arm, and radialis means radial side, right? So or radius. Um, Brachioradialis, right? This is a posterior forearm muscle, right? So we're going from the humerus to the radius, and this muscle's sole job is to flex the elbow, right? This has a unique function because it's the only muscle in the posterior compartment, um, as well as the anterior compartment, right? So the only muscle in the forearm really that's dealing with elbow flexion. So that can be a way for you to remember it. It's the only muscle that's dealing with elbow flexion, right? And all of the muscles of the posterior arm are innervated by the radial nerve. So all of them. So now that we have that, let's move on to the next muscle. So we have a set of two muscles: extensor carpi radialis longus, extensor carpi radialis brevis. It is a mouthful, right? So extensor carpi radialis longus and brevis are behind or posterior to brachioradialis. So extensor carpi radialis longus, extensor carpi radialis brevis, right? So we can kind of pair them together when it comes to muscle function. So extensor carpi radialis longus and brevis go from the forearm, right? Go from the lateral forearm, humerus, lateral forearm, all the way to the metacarpals, right? And they extend and abduct the wrist. So extend and abduct the wrist. So extend and abduct the wrist. So now that we have that, so we have extensor carpi radialis longus and brevis. Now we're going to move on to extensor digitorum. So extensor digitorum, remember that digits, anytime you hear that digitorum, it's going to digits 2 through 5 for the most part. All right, pollicis, digit 1. So we have extensor digitorum. So extensor digitorum is going to be extending the wrists and digits 2 through 5. Right, you can see it going to digits 2 through 5. So it's going all the way from, right, you can see it going from the lateral humerus and forearm, right, to the digits 2 through 5. All right, so we have that. Now we're going to move on to the last muscle that you guys actually need to know. I'm sorry, the second to last muscle. We still have two more. So the second to last muscle is, I'm going to show you guys extensor carpi ulnaris. So remember, we're looking at flexor on the anterior. Now we're looking at extensor carpi ulnaris. So we can see it going, we can see it inserting on the carpals. So it's going from the forearm to the carpals, and it's going to be extending and adducting, extending and adducting, right? Extending and adducting the wrist. So extending and adducting the wrist, extensor carpi ulnaris. So extending and adducting the wrist, extensor carpi ulnaris. And then the next muscle that we have is extensor pollicis longus. Right, so we're only learning about 15 or 16 of the muscles in the anterior and posterior compartment of, so the forearm in general, there's a couple more muscles that we're not learning. So um, I'm not going to touch on those because you guys don't need to know them, but it's good to know what they're not, I would say. So remember, this is extensor digitorum, so we know we went over that. Let me give me 1 second. Let me just fix this real quick. All right, so here we go. So we have one more muscle to go over, which is extensor pollicis longus, which is this muscle here. So extensor pollicis longus, pollicis, pollicis, right? Whatever, however you want to say it. You can see it going all the way to the thumb. So extensor pollicis longus, and it goes all the way from the forearm to the thumb, and extends the wrist and the thumb. Right? Again, innervated by the radial nerve. Right, so we don't need to know extensor pollicis brevis, or I'm not even going to go over the names, but just there's four other muscles that we're not learning in the, about four or five of the muscles that we're not learning in the posterior compartment. So there's a couple things that we're not learning, so don't worry about those. So take that as a relief that there are more muscles in the forearm that we're not looking at. But you guys only need to know this last muscle, extensor pollicis longus. Alright, so now that we did that, I'm gonna go over the muscles of the hand, and then we're gonna move into just the vasculature, and then we're done. And also, I found a way to make the hand zoom in a little better so we can actually see it well. So I'm just gonna go over so long to pinky, here comes the thumb one more time. So we have scaphoid, lunate, triquetrum, you have pisiform, you have hamate, capitate, we have trapezoid, and trapezium. Right? So we have, I'm gonna go over it 10 more seconds on it just to make sure it's solidified. So we have so long to pinky, here comes the thumb. Trapezium, thumb. Now that we have that done, I'm going to go into the muscles here. Right, so first we have hypothenar muscles. So hypo, right, means small. That hypo prefix means small, decreased, less. So hypo, right? Whereas hyper is more, right? Bigger, larger, right? More than average, right? So hypothenar are the muscles, right, near the pinky side. Right, so these are going to be our hyperthenar. Don't worry about the actual names because the hypothenar muscle are comprised of three different actual muscles. So don't actually worry about what the names are because they're comprised of um, three different muscles that you guys don't actually need to know, but we're using hypothenar as a group, kind of, so you can just remember these three muscles as a group of muscles. So if that makes it any better as well. So I'm gonna remove this. So so there's three muscles, right? So those three muscles comprise the hypothenar muscles on the ulnar side, right? And these muscles are responsible for flexing, um, abducting, and slight opposition of the pinky. So flexion, abduction, and slight opposition of the pinky, and are innervated by the ulnar nerve. So all these three are the hypothenar muscles. I selected that last one, but I guess it didn't really select. There we go. So these are the hypothenar muscles on the ulnar side. And then we have our thenar muscles on the thumb side, the radial side. And then, right, so those three muscles, right, 1, 2, 3. These are the thenar muscles. So it's a group responsible for flexion, opposition, and abduction of the thumb, right? Innervated by the median nerve. So hypothenar, innervated by the ulnar nerve, thenar, innervated by the median nerve. So now that we have that down, right, so you could also remember when you're looking when the thenar and the hypothenar muscles are dissected, the thenar are always going to be bigger, and on the thumb side, the hypothenar are going to be smaller, and on the pinky side. So now that we have that down, we can memorize. Sorry, we can move on to the lumbricals. Right, so there are 4 lumbricals. There are 4 lumbrical muscles. So I'm going to press all of them for you. This is the first one. This is the second one. The fourth one is right there. Okay. So these are our 4 lumbrical muscles. The lateral 2, right? These 2 are going to be innervated by the median nerve, and then the medial 2 are going to be innervated by the ulnar nerve. Right? So, and they go from the tendons of flexor digitorum profundus to the extensor expansions from extensor digitorum. They're anterior to the metacarpal phalangeal joints and posterior to the interphalangeal joints. Right, and these are responsible for flexing the MCP joints or the metacarpal phalangeal joints, and extending the interphalangeal joints. So I know that's a lot to take in, right? So just imagine folding your fingers, but keeping the fingers straight. So folding your fingers, right? Flexing your digits at your knuckles, but keeping all of those joints straight, right? Imagine holding onto a cliff, right? You need to flex where your knuckles are, but keep your other fingers straight, right, to grip. So these are often called the cliffhanger muscles. Right, so these are your lumbricals, right? So I know the explanation was very, very dense, right? But make sure that you just understand their cliffhanger muscles. Imagine holding onto a cliff, right? Your interphalangeal joints are extended, and your metacarpal phalangeal joints are flexed. So, right. So, and let me kind of explain, because maybe I didn't explain that very well. So, right. So you have your okay. So you have your metacarpal phalangeal joints. That would be right here, metacarpal phalangeal joints. So imagine you flex those joints, and then you have your interphalangeal joints, right? Or your proximal interphalangeal joints, which are right here. So interphalangeal joints. These are your proximal interphalangeal joints. 1, 2, 3, 4. And then you have your distal interphalangeal joints. Right? So imagine flexing at these joints here and keeping these joints straight or extended, right? That would be what the lumbricals are responsible for. So we have that down. Now we can move on to the interossei. So let's do that. But let me get the lumbrical selected one more time just so we can see that now after I've explained that and understand what that is doing. Fourth lumbrical. Okay. we can see how I said they're anterior to the metacarpal phalangeal joints, all right, and they're posterior to these interphalangeal joints. So they're posterior to the proximal and the distal interphalangeal joints. So they flex the MCP joints or the metacarpal phalangeal joints, and they extend the interphalangeal joints. So now we can move on to the palmar interossei. So lumbricals are superficial. The palmar interossei are more deep, right? So superficial lumbricals, the palmar interossei are a lot deeper. So I don't know if I'm going to be able to select all of them. Okay, I got two of them, but I would have to remove a bunch of other things for you to see the rest. But in fact, let me just. That's a little bit better. Let me just remove the nerves. Okay. There we go. Okay. So we have three palmar interossei. So the palmar interossei go from the metacarpals to the proximal phalanges, and they adduct the digits with respect to the middle finger, so or respect to the third digit. So you know how you move your, so imagine moving your digits away from your middle finger. They're responsible for adduction of your digits with respect to your middle finger. And so I always remember as the acronym PAD. So palmar interossei, adduct, adduct your digits, right? And so innervated by the ulnar nerve. So the palmar interossei adduct your digits. So PAD, and then the acronym DAB is for the dorsal interossei. So dorsal. So I'm going to remove the palmar ones and select the dorsal ones. There we go. Okay. This first one here. So the dorsal interossei are a lot more superficial, so you can see them a lot better. So when you're looking at the donors in lab, you're going to be able to see them a lot better than you are the palmar interossei. So the dorsal interossei have the acronym DAB. So the dorsal interossei are going to abduct your digits with respect to your middle finger. So bring your digits closer to your middle finger. And again, innervated by the ulnar nerve, and it goes from the metacarpals to the proximal phalanges. All right, so those are mostly everything, okay? Besides the blood vessels and the nerves, I'm going to go over that briefly, and that's it. All right, so now we're here. We're going to be looking at the radial artery and vein So remember, we were looking at the brachial artery and brachial vein, right? We're looking at cephalic. We're looking at the median cubital vein, right? We were also looking at the basalic vein, right? That was all in the um, arm. Now we're looking at the forearm. So right, remember we went from axillary to we went from subclavian to axillary to brachial, right? Those regions in the anterior, um, medial anterior arm. Right now we're looking in the forearm. So you have the continuation of brachial artery and brachial vein. So let me move this down a little bit so we can see it better. Okay, there we go. So I just selected the brachial artery. Now I'm going to select the brachial vein. Okay. Okay. So, all right. So we have the brachial artery and the brachial vein. So you guys don't need to know these other structures. Just worry about the brachial artery and the brachial vein. Brachial artery, brachial vein, brachial artery, brachial vein. Right, and the brachial artery splits into the radial artery and the ulnar artery. So I'm going to remove the brachial vein, so we can see that. So our brachial artery splits into our radial artery and our ulnar artery. Right, so brachial artery splits into radial and ulnar artery. So brachial, radial, ulnar, and then we have our brachial vein splitting into the same pattern, the radial and the ulnar vein. So I'm going to select all of those for us to see. So we can see the blood flow pattern. You see brachial splitting into radial and ulnar artery and vein. So brachial artery and vein split into radial, ulnar, and vein. Right, and these structures are going to be combined when we're looking at them in the wet lab. So I wouldn't worry about separating the artery and vein. So for radial, the artery and vein, I wouldn't recommend. Well, not recommend. I wouldn't expect you guys to know the difference between artery and vein. Similarly with ulnar artery and vein, because they're not really separated that well. So we have that, and then we have the median nerve, right, running in the middle of the anterior forearm, and then we have the ulnar nerve, right, running on the most medial part, right. So in the middle of the anterior compartment, so this is our anterior compartment. In the middle of it, right through the middle of it, we have the median nerve, and if we move more medially, we have the ulnar nerve. Right, and coming from the radial artery, we have the superficial palmar arch arteries. Alright, so that's that. Superficial palmar arch arteries coming from the radial artery. Alright. And the last thing I want to mention is where where the nerves are in relation to some of these muscular structures, and that's it. Sorry if I click on the form. Right, so if I want to find the median nerve, right, so I need to look under flexor digitorum superficialis, right, and above flexor digitorum profundus, we have the median nerve, right? So in between profundus and superficialis, you find the median nerve, and lateral to flexor digitorum, sorry, not lateral, medial to flexor digitorum profundus. So this is the medial side, this is the lateral side. So medial to flexor digitorum profundus, you find the ulnar nerve, right? And you also find the ulnar artery and vein medially to flexor digitorum profundus, and laterally to flexor digitorum profundus, you find the radial, right? Radial artery and radial vein. And that's it. I hope this helped. And have a good rest of your week, guys.